Okay. Oh, I love it when it does this. Yeah, it's great. So good. Okay. Yeah, it should be. Okay. No, it's not working. Okay. Yeah. Okay. Yeah, it's not working. That's right. Yeah. That's not it. That's right. That's the story. Yeah, that's it, man. Oh, those are going. Okay. Well, hello, everyone. Yeah, I know. We had some tech difficulties for our live today, just would not connect. But now I do believe that we are connected and we should all be good to go. I'm here with you once again. You know, my favorite part of the week is literally being here with you all, answering your questions live. So here we are. So let me come into the group. Rachel, Melissa, Laura, hello, and welcome back. So, as you know, you guys know the drill. Put your questions into the comment section. If you are watching this on Instagram, you have to go to the Just Fix Your Thyroid Facebook group. Join there. We are 22,000 and growing. Amazing, amazing members. We're like a big family in there. You are not alone. You will get love. You will get support. You will get the answers that you need to up level your health, all at no cost. There is no charge for this group. This is my passion. My passion is being here with you, educating you, empowering you, answering the questions that are on your mind that can help take your health literally to the next level. Because when you know the answers, when you are educated, you become so powerful. And I think, we enter into a doctor's office or a virtual visit or whatever it is with a medical professional. I don't care if it's myself, my team, your PCP, your OBGYN. And I believe this is from when we were kids. We were taught that, the doctor knows best, right? The white coat knows best. And we almost shrink. We shrink down and we become timid and we lose our power and we lose our voice. Now, what did I just say? In the world of thyroid, we lose our voice. And yes, there's a very esoteric connection between thyroid problems and not speaking your truth and not speaking up for yourself. And this goes into doctors' offices. Absolutely. Especially women and women's health. We are being medically gaslit left and right, even by female doctors. So we need to stand up for ourselves. We need to find our voice. We need to be able to speak in an educated, empowered way in order to get the help that we need. And that is literally what I am here to do and here to empower you. Now, I will absolutely 1,000,000% shamelessly and unapologetically plug my book, The Thyroid Fix, that you see in the background. This is coming out on May 12th. I am asking all of you to please pre-order, and here's why. You can go to thyroidfixbook.com and pre-order. And I know many of you on here already have. I love you for it. I appreciate you so much. You have no idea. The people that haven't clicked buy now yet, you just have to. I mean, there's no other way to say it. You need this. You need this book. Every single woman over the age of 40 needs to have the Thyroid Fix in her collection so she can reach for it. And I mean the hardcover. I'm an Audible girl too. I get it. I haven't even recorded the Audible yet. I will. Believe me, I will. I get it. It's a good accompaniment, but you need the actual book so you can fold over pages, so you can highlight. This is going to be the last thyroid book you ever need. This is the Thyroid Bible. This does something that no other book in history has ever done, nor do I believe that any author will ever have the guts to do it, because buttholes of doctors will be puckering when they actually read my book. It is teaching you the medication and the dose that you need based on your labs. And all authors everywhere of perimenopause books, menopause books, hormone books, thyroid books, they're all going, can she do that? Like, can she actually teach people to use their brains and to figure out what kind of thyroid hormone we play? Wait a minute, that's just for the doctors to decide. No, it's not. You're smart. You're very smart. And I can absolutely teach you exactly what your labs mean and what medication and dose you need, or what you need to change your med and dose to. Now, to have the doctor to implement that, that's a whole other discussion, right? That's why we're here. We prescribed all 50 states. We got you. And we know what to do with your thyroid hormone replacement. But it's important that you know and that you are empowered, because what if you could teach your doctor? What if you could guide your practitioner? What if you could educate them based on your knowledge? You are smart enough to do that. And that is exactly what this book does. It is unlike any perimenopause, menopause, thyroid book out there. It is vastly different from anything you will ever put your hands on and have in your book collection. So I am telling you, I am asking you to pre-order now. I know you're like, well, it doesn't come out till May, so I'm just going to wait. Here's what happens by pre-ordering. It's more than just you making sure that you get it shipped to you that week, right? And that you're the first in line. Number one, it sends a message to the algorithms. Because remember, we are living in an algorithm world. We're not living in a people world anymore. We're living on an algorithm computerized world. So what it does is it triggers all the algorithms in book space out here to say, hey, this book is actually needed and necessary, and it's wanted and it's in demand. We're going to show this, just like your Instagram post, right? If you do a really good Instagram post, Instagram says, we're going to show this to more people because we got these people interested over here. So that means more people over there must be interested. So it shows this to more people. It gets this book into the hands of the people that need it, men and women, of the people that need it. And that is, in my opinion and in my estimates, in my data, in my stats, that is 90% of women over the age of 40 and 60% of men over the age of 40 need the Thyroid Fix book. They need it as a handbook. Because whether it's right now, a year from now, or 3 years from now, you are going to be hit with a boatload of symptoms. You are going to be medically gaslit. You are going to be told that you're normal and everything is fine. You are going to be handed a Band-Aid prescription medication and sent on your merry way. And you're going to think back, I go, what was that book again that I heard about that I needed? What was that? Why don't you have it in your arsenal so you don't gain the 20 pounds or the 30 pounds or the 50 pounds, so you don't lose your job and your relationships and your marriage, because that's what happens, because thyroid affects every aspect of your life. And I could go on and on for the next hour about that, but I won't. I'm just asking you, go to thyroidfixbook.com, pre-order this now. Help me, but help everyone else. Help the women out there that are suffering, that they just haven't come into my world yet, but I'm right here waiting for them when they do, with open arms and with a ton of love and a ton of support. So by owning the Thyroid Fix, you will be on the fringe. You will own a book that hasn't been done before. You will own content that is going to shock the entire functional medicine and medical community. Integrative, functional, Western, don't care. They're all going to fall over when they see what I actually put in the Thyroid Fix. So thank you for listening. All right, on to your questions. Now, again, if you're listening on Instagram, pop over into the Just Fix Your Thyroid Facebook group, because that's where I'm reading these questions from. Miss Rebecca, pre-order my book. Thank you. I love you. And Laura did. Thank you. I appreciate it more than words can express, honestly. Like I can see who pre-ordered. I know the people in our group who pre-ordered. And listen, you will always be top in my mind. You will. Oh, and in addition, we are having a huge all-day launch party. I believe it's going to be May 15th. I will confirm that date with you so you can mark it down. We're going to be live on YouTube. We're going all day. We are doing Fixer supplement giveaways. We're doing a year supply of Thyroid Fixer giveaway. We are giving out huge discounts on programs. I'm bringing in experts to answer your questions live. It's going to be a blast. So you do not want to miss that at all. So you got to order a copy of the book. You get a VIP ticket to our all-day event. Okay, now on to your questions. Okay, hi, Sin. Hi, Sarah. Hi, Leslie. Miss Helen says, hi there. I would love your input on my labs if possible. Free T3 is a 2.8. It's a little bit low. Helen, don't like that. TSH is a 0.6. T4 and T3 uptake we don't care about. Free thyroxine index is pointless. Your T3 reverse is a 13. You do have antibodies. So you have Hashimoto's. We know that for sure. And then so you stuck estrone in there of a 24. You had a total hysterectomy 8 years ago. Let's see. Oh, your estradiol is a 36. So, all right, Helen, you have no source of, and I'm in the same boat as you. I had a total hysterectomy as well. So you have no source of hormones. They have to come in exogenously. You're saying that you are currently on an estrogen patch and that is it. Like you know what amazes me? This is just a side note. The visceral full body response I get when someone is not being treated properly. I mean, it's like my blood pressure rises. Like I want to just like kill somebody. Seriously. So first of all, Helen, you should never, ever, 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 ever be given estradiol unopposed. Whoever gave you the patch and wrote for it knows nothing about hormones. Zero, zip, zilch. They started you on a 0.025 milligram patch and you had a total hysterectomy. Are you kidding me? Do you really think that that is enough to replace the non-existence of ovaries? No, it's not. And in addition, you should never, ever, ever, ever take estrogen without progesterone. I don't care if you have a uterus or not. In addition to progesterone balancing out estrogen, it also has a host of its own beneficial effects. Progesterone protects our bones, protects us against osteoporosis, helps us sleep, helps with anxiety, is anti-prolific, protects us against cancer. So this person giving you the patch knows zero about hormones. It's a shame. Like these are the times where I just want to have the ability to strip licenses, to just take them away, like medical malpractice, or just go, like your doctor needs to just go practice family medicine. Go write scripts for antibiotics or something. Like that's it. That's all you're qualified to do. Just stop. And don't claim to know thyroid and hormones to a person because you don't. So your testosterone's in the toilet as well at a 13. You have zero free testosterone at a 0.8. You don't have enough. Your progesterone's in the toilet at a 0.2. DHEA, that's neither here nor there. I mean, your DHEA is a little bit low, but does that really matter in the grand scheme of things? Like your free T3 is low, your estradiol is low, you're not on progesterone, you're not on testosterone. So you need to address all of that. Sure, you could throw in some DHEA. It's not really going to help unless you address all the other things too. And for anybody new listening, especially over here on IG, I see y'all over there. I get fired up. I absolutely, I am. If you have never come across my path before, you will know that I am very blunt and I do not hold back. And I will tell it to you like it is with pretty much no filter. So if I see a medical practitioner doing things the wrong way and doing wrong by people, I'm going to say something, and it's going to be blunt and explicit, like I did with Miss Helen. Helen's probably like, "Whoa, I didn't know she was going to say that." But yes, Helen, I am very, very, very honest. Very honest. Okay, so some of these, hold on, let me go back to the comments here because some of them disappeared for some reason. I don't know why. Oh, Leslie, the bulk buy info for the book. So that is, thank you for asking. So that's thyroidfixbook.com/bulk buy. And yes, Leslie, you have an excellent point that I will mention. So the bulk buy, it can be 100, it could be 200, but we have some really, really sweet bonuses for even just $50, for $25. We have free product. We have the advanced lab masterclass that I teach you. We have, if you do happen to purchase 100 books, you get 14 weeks with me reading your labs in the thyroid and hormone fix program. So there's some pretty sweet bonuses in there for bulk purchases, So you go to thyroidfixbook.com/bulk buy and you'll be able to see all of those, all of them. Thanks, Leslie. Thank you for the reminder. Okay, Miss Laura, are we concerned with the following labs? TSH it's like mine, 0.005. T4 6.3, T3 uptake doesn't really matter. Free thyroxine index doesn't matter. You are missing. Okay, wait. Or do we only focus on these? Yeah, free T3 is 3.6. Free T4 is a 1.1. TPO antibodies 273. Thyroglobulin is a 21. So we know that you have Hashimoto's. Here's the problem is that your reverse T3 is a 21. So when you are posting these, for anyone that's posting labs, please also post what medication you're on and the dose, as well as your symptoms. So I'm going to assume, Laura, that from these labs with a reverse T3 of a 21, that you're taking either T4 only, or you are on a large amount of natural desiccated thyroid, which is 80% T4. And you are just simply not converting very well. The reason why, and this is the perfect example, I'm going to teach you guys something here, so hang tight. Your free T3 is a 3.6, okay? And I teach this in the book as well. In certain people, when reverse goes up, and it goes way up like yours is right now, it's a 21. That's pretty darn high. We're not talking about a 14. That's a little bit over the optimal range. It's a 21. Your body is in full shutdown hibernation mode. Might as well just go lay in a bed. That's probably what you feel like doing and not getting up. So what's happening, the reason why you're getting a pretty looking free T3 of a 3.6 is because it's like a dam, right? So I'm going to bet, I'm going to place a bet before I scroll down. I don't know if you posted anything yet, Laura. I'm going to bet that you're on natural desiccated thyroid. I'm going to bet that you're working with an integrative or functional practitioner that is half-assing their way through your treatment program, and they're just putting you on NDT, and they keep increasing your NDT. And I'm going to bet, I could be way off on the dose, but I know you're on NDT. I'm going to bet that you're taking like 60 milligrams twice a day, or maybe you're on like 90 milligrams once a day because they don't know enough to tell you to split dose it. Maybe you're split dosing it on your own because you've listened to me ad nauseum. Either way, you're on too much T4. You need to reduce the NDT medication and add in T3 to lower that reverse T3. So I'm going to guess that you are very hypothyroid with your symptoms right now. So this would be where I would, with your antibodies, I would add in Hashimoto's support by the fixer. We used to call it Hashimoto's fixer. And then, the 3-letter government agency says, no, you can't claim that you can fix a disease. So now it's Hashimoto's support by the fixer. Side note. And then I want you to add in thyroid fixer because that's going to help with conversion. And I want you to add in T3 conversion fixer. So we're going to stack you. We're going to go T2 in thyroid fixer. That helps with T4 to T3 conversion. Then I have an amazing podcast coming up that gets into the deiodinase enzymes. That's what helps us convert. Well, 2 of them help and 1 of them hurts. So we're going to break that down in that episode. But in a nutshell, T2 helps with activating the deiodinase enzyme that converts T4 to T3. Then you add in T3 conversion fixer that has basically the backbone of nutrients that help convert T4 to T3. Then you lower your antibodies and inflammation with Hashimoto support by the fixer. Then maybe, even if your doctor won't listen to us, maybe you'll get some of that pushing over and you'll be able to lower your reverse T3 to kind of help things out. Okay. Sin. My Pregnenolone is a 27. You need more Pregnenolone. Taking your Pregnenolone fixer 1 per day. Should I double up on it? Yeah, I think what's going on is you are stressed. So when we are stressed out, our adrenals will steal Pregnenolone. There's something called Pregnenolone steal. It will steal pregnenolone because pregnenolone is a backbone to make cortisol. So our bodies know that when we're not making enough of our own cortisol, it needs to use something to make more. And that's where it will steal pregnenolone in order to make more cortisol. So I think that's what's going on. I would bump that up to 2 per day. And then you're saying, I suggested to my doctor that she take your program. Not sure she appreciated it. At least she will prescribe what I ask for. Bonus. I think I will give her your book. I already ordered it for me. Well, there you go. Yeah. I mean, and there's the purpose of the bulk buy as well is, give this to your doctor. I remember years ago, years ago, there was someone in the group that said that they had purchased Paul Robinson's circadian T3 method and gave it to their doctor. So their doctor could learn more about T3 and how to pulse it and all of that. So same thing. Yes, get the thyroid fix and give it to your doctor. Because even if he or she initially takes offense to it, in the dark corners of their home, they'll be reading it and boning up on it to maybe learn. At least the good ones will be, right? Carolyn, I know that once you start taking T3, your thyroid stops making it. Well, no, not entirely. Once you start taking T4, any kind of hormone that is brought into our body is going to have a negative feedback loop onto our brain, except for T2. That's the only one that doesn't have a negative feedback loop. So you can take T2 without shutting down your own thyroid hormone production. But all the other hormones, I mean, even, when we take birth control, we are shutting down our own natural production of progesterone. When we take testosterone, we are shutting down our own natural production of. Now, your body will still produce a little bit, but here's the thing. And I know there's more to your question. I'll get to that in a second, but this is a great teaching moment, Carolyn. So here's the thing that you have to remember. If it's kind of like having a bad employee. So if you have a bad employee that's only doing 10% of their work instead of 100%, you could keep that employee around, but you're only going to get 10% production. You're going to be paying full price for 10% production. Or you can bring in another employee that's going to give you 100% and fire the 10% employee. It's the same thing. I don't know if that's a good or bad analogy, but I think it helps you understand it. That if your thyroid gland is only producing 10% of thyroid hormone, what do you care about bringing in a good employee, i.e. the right thyroid hormone replacement, that, it's going to, take the place of the 10% employee. It's going to take the place of your thyroid gland that's not doing a great job anyways. So what do you care if it stops spitting out its 10%? We can't work with 10% anyways. It's not good enough. So just step aside, just move over. Let's bring in the big guns. Let's bring in the effective thyroid hormone to replace that. So I'm just saying, it's not just T3. It's all hormones across the board will naturally shut down your own production. But if your body isn't making enough of it in the first place, who cares? So same thing. I'll give you one more analogy. Type 1 diabetes. Pancreas not producing the proper amount of insulin. It's still spitting out some, but it's not producing the proper amount of insulin required to lower your body's blood glucose level and shuttle nutrients into the cell. So therefore, we need to use exogenous insulin in the form of a pen or a pump in order to provide the body with the hormone that is no longer being properly made by the body anymore. It's the same thing. We don't care about bringing in insulin because without the insulin coming in, that person will die. So we don't care about replacing it, shutting down the piss poor production of the pancreas. Same thing with thyroid hormone. Okay, so is that also, I'm kind of answering your question without reading it. So is that also true for progesterone, estrogen, testosterone? Yes, you are correct. And all of what I just said applies. All what I just said applies. Okay, Asia Beatrice. That's a beautiful name. Hypo and low stomach acid. Is that primarily a thyroid problem? Will stomach acid be restored with optimal thyroid levels? It is a correlation. So with hypothyroidism, there's naturally low betaine hydrochloric acid. There's a lower production. Because if you think about it, the thyroid gland, head to toe, it runs the show. So anything is going to be lower and slower, right? Metabolism, mood, gastric emptying, motility, and stomach acid. Digestion is going to slow down. Production of stomach acid and digestive enzymes going to slow down. So taking a digestive enzyme. So when I built Digest Fixer, I built it for Mahashi peeps because we have betaine hydrochloric acid, a little bit of ox bile to support the gallbladder, and then the digestive enzymes to properly break down and utilize your carbohydrates, your protein, and your fat. So with the other thing that I see oftentimes when we're looking at labs, we'll look at the protein marker and we want to see that protein marker above a 7. Sometimes this will reflect what a person is taking or not taking in terms of protein intake. And then other times it will require just it's an indication that it requires additional help to properly digest, utilize, and assimilate your protein. So taking digestive enzymes, huge help. Digest Fixer, huge help when you have low stomach acid, when you have Hashimoto's. I've not necessarily seen it restored, Asya, but that doesn't mean I just honestly I just haven't gone down. I don't even know how we would know. I'll be honest. I'm not sure. So I guess we could extrapolate that if we're improving all functions by optimizing the thyroid, then production of low stomach acid would increase, but I don't know that there's a way to measure that necessarily. Diva, do you believe in the T3 efficiency that comes with being keto long term? Wait, let me read your whole thing here. I'm talking about myself. I've been keto for about 18 years. I feel amazing. I have no symptoms on very low T3. I mean, very low, like 1.5 and 0 symptoms. Usually at that rate, my level of TSH is low, free T4 on range, reverse T3 is low, and I do have tons of energy on that level of free T3. With that level of free T3, I believe that it is because our body becomes efficient, needing less T3, so it doesn't need as much, especially because since we have no carbs and T3 usually is involved in carb metabolism, the need goes down since you're not eating carbs. I always keep wondering, though, if I should try to up my free T3 levels because it seems like it's so involved on so many other things. Well, yeah. So that's what I was thinking as I was reading your question is that, but it's involved in so many other things of the body, other systems, other functions of the body. So that's a tough question, girl, because on the one hand, you feel good. And the 4 most important words that any practitioner can ask you is how do you feel? In fact, if your practitioner that you're working with is not asking you, how do you feel? I want you to run far, far away from that practitioner because they will never, ever, ever be able to help you and they will always treat you like a lab value. So, how do you feel? You say you feel great. So, are we going to chase your free T3 with medication? No, not necessarily. Yes, it is involved in other factors. So, I would ask you, do you have any symptoms? Are you pooping every day? How's your brain function? How's your mood? How's your motivation? Your energy is obviously okay. Your weight is okay. How about your hair? Outer corners of your eyebrows? Are you cold intolerant? How's your sleep? So if you have any symptoms at all, maybe we play with just trying to bump that up just a smidge. But again, if you're saying I feel great, that's hard to chase. That's hard to override because we also don't want to push you into a hyper state by giving you T3 that you don't need. So this is where it really becomes very, very nuanced and very personalized. When we're talking about thyroid treatment, it is incredibly nuanced. There is no one size fits all. And this is why I drive the point home that you must be working with a thyroid and hormone expert. That is what we do at the Advanced Thyroid and Hormone Clinic. That is what we do. We could do it in our sleep with our hands tied behind our backs, literally. And this is where it's easy for us because it's what we do. It blows me away though when, just like we talked about earlier in this conversation, where there are functional and integrative docs that kind of go like, Yeah, I can treat your thyroid. I'll figure this out. I'll just use the standard lab value range, or I'll use that optimal range that somebody posted on Instagram, and I'll just wing it. No, you can't wing the thyroid. You either know it or you don't. You know it like the back of your hand. You can do it in your sleep or you don't. And just be honest with people, for goodness sake. If there is a practitioner listening to this that is half-assing thyroid treatment with people because you're not a thyroid expert and you're not a hormone expert, like the person that gave somebody a 0.25 milligram patch after a hysterectomy, and that's all they gave, like, just stop. Pick a lane and focus on that lane. I don't come on here and say, I'm a Lyme expert. I know every Lyme marker there is, the 41 and the 52 and I know what test it. No, I don't. I will fully admit I'm not a Lyme expert. I don't play one on TV. Like, no. And I'm not going to bullshit my way through that. But functional and integrative doctors bullshit their way through thyroid treatment every single day. And it drives me crazy because it could do more harm than good. So, okay, soapbox off. Jessica, when and for who is desiccated beef thyroid recommended? Currently taking 45 milligrams of Armor and 2 thyroid fixer, and curious if I should add it. Well, you're already on porcine desiccated thyroid, Jessica, so there's no need to add in a bovine desiccated thyroid. And I will tell you, even with the 45 milligrams of Armor that you're on, I would also now you're taking thyroid fixer that's going to help you convert that T4 to T3, because Armor is 80% T4. So thyroid fixer is going to help with that conversion. But we also want to know what your reverse T3 is. Okay. Helen, can you let me know where to start or what to ask for? So I think I gave you a ton, Helen. So if you have any other specific questions, let me know. But I think I went off on a tangent with your post there, Helen. Miss Fran, it's so good to see you. Karen, hello. Tammy, hello. Laura, sorry, no, I am on Levo 88, Lio 25, split. Yep, feel exhausted often. Okay. So let me go back to, I got to scroll back here. There we go. Okay, Laura. All right. So yeah, the Levo, it's too much. So again, it's no, I didn't nail it with the NDT. But I kind of had it. I knew there was a T3 in the mix because you're getting a backup. It's like a dam backing up. So you're taking the 25 micrograms of T3, but it's not getting to your cell. It's just floating around in your bloodstream. It's not getting to your cell at all. So this would be a case of lowering the T4 significantly and then doing all the things that I said. Add in T3 conversion fixer, add in thyroid fixer, add in Hashimoto support by the fixer. That should help you. But a lowering of your T4, I can't tell you to what dose because you're not a patient. Lowering of the T4 will definitely help. Miss Jody, hi Jan, good to see you too. Betty, does the book cover men? Oh yeah, of course. I have a male friend with Hashimoto's and is currently over 300 pounds. His endocrinologist waited until his antibodies were over 120 before starting him on meds, and is only treating with levothyroxine and watching TSH and monitoring. He is taking protein shakes, trying to intermittent fast, but stalemated with minimal response. I'm thinking that your book would give him hard copy of your incredible, empowering teaching. Thank you. And yes, in fact, there is a whole chapter just for him. And it is for thyroidectomy patients and partial thyroidectomy patients. And you can tell him that Dr. Amie said that being on T4, and this is a statement that's in the book, that being on T4 after having a total thyroidectomy is medical malpractice. Now, what did I say earlier? Oh, the buttholes of doctors everywhere are puckering. Puckering. Did I just say medical malpractice? Oh my God. Yeah. Yeah, it is. Because you took an oath to do no harm. And in doing no harm, that also means treating properly. We have the thyroid gland that once produced T4 and T3. We have the thyroid gland that is one of the main conversion glands of T4 to T3. I'm simplifying. We know it converts in the liver, in the gut, and peripheral tissues in the thyroid gland. So we remove that too. And then we give T4 only. Now just think about that statement. We remove the thyroid gland that produced T4 and T3. T3 is the active thyroid hormone. T4 is completely and totally inactive. We do not have a single cell receptor site on our cells for T4. We only have it for T3. And then we give T4 only and cross our fingers and wish on our rainbow that this poor person who is under metabolic stress, who is carrying excess weight, who is probably insulin resistant, who probably has low testosterone as well, is going to convert that T4 to T3. Are you kidding me? Are you kidding me? So, yeah, Betty, get him the book and then tell him what I said and tell him that we're here to help too. That's the other layer, is like I would like him to get help sooner rather than later. So yeah, by all means buy him the book, but that's, I would like him to enter our care now, actually. So I would rather have him book a call. He can read the book later, but he needs help and he's not going to get it with an endocrinologist. He's just not. Laura, you actually recently switched to a new functional provider. So she is very willing to work with me and adjust meds as needed. Beautiful. Beautiful. That's what you want. Jennifer, how is it decided what products of yours are found on your Amazon storefront? I would love to see SHBG Fixer on there. Most of the time, it's just a little behind the scenes. You guys, that's like a behind the scenes question. So Amazon is actually a huge pain in the butt to work with. So even though we pay for and have third-party testing, Eurofins testing, we're licensed and we have this badge and that badge and we test and we do this and that. I mean, it's tested 6 ways till Sunday. That's not good enough for Amazon. So sometimes they're like, well, you have to spend an extra $10,000 to get this tested with our facility. I'm like, oh, well, that's a nice way for you guys to make an extra 10G, isn't it? So that's why we're like, we kind of pick and choose what we put on Amazon. Because they're pains to work with. They really are. So I will take that into consideration about putting SHBG up on Amazon. But if they want 10G of my money just to test it for the 10th time, then no, they don't get that. I love the convenience of Amazon, but man, behind the scenes, they are pitas. They are pitas. Pain in the asses, pitas. Melissa. Okay, so you're responding to Diva. Her people expresses in the carnivore space. Okay. Yep. Thank you for responding back to her. That's why I love this group. We're all big. We're all one big family. I love it. And again, if you guys are over, I see you over there on Instagram. I see you over there. You need to go over and join the Just Fix Your Thyroid Facebook group. That way you can ask your questions live and get them answered live. So you got to do that. Okay, going back to everybody in the group here. Miss Kristen, what are your thoughts on the drug DHEA and its effectiveness for increasing libido? I looked this up a while ago and I remember rolling my eyes. Hold on. ADDYE. Is it ADDYE? Yeah, it is. It's non-hormonal. So we need to know what it is, though. So why not just use hormones instead of a drug? You know what I mean? Like that. This is where I'm coming in. It's like, why do we want to put in our bodies something synthetic? Which I can't even find what it is. I need to find like the actual breakdown of what's in it. Like, what is it? I know it's used to treat hypoactive sexual desire disorder. in women, meaning low libido. Low libido. Um, girl, I'm not even seeing what it. I mean, there's a whole bunch of contraindications. Um, whole list of contraindications. My goodness. But I'm just use hormones. For goodness sake, just use a hormone. Okay, Tracy, how do we sign up for a review of my labs and consult to see if being a patient would be good? So, Tracy, when you do a call with my team, so I will grab that link. If you go to dramie.com and you click book a call, see if I can send this to you here, and we'll post it right there. Oh no, I can't because I'm in here. So go to go to dramie.com, DRAMIE, and right there on the front page, you'll see a big yellow button that says become a patient. So Tracy, we don't review labs on this call. Really, I mean, that's kind of what this group is for too. I mean, if you have questions about, what are my labs saying, just like I've been going over with people today, you can post them in the group and you will absolutely get feedback from me, from our team members in the group, from patients that have been with me. I mean, you guys all know Lisa, Angeliki, Shannon, Daniel. I mean, these are real people patients that genuinely just love being in there. They are not being paid by me. They are just in there giving their time, their love, their attention, their knowledge, their experience. They've been with me for so long. They know exactly what I would say and do. So they're in there giving you feedback as well. Half the time I'm in there going, what Lisa said, what Daniel said, what Shannon said, what Angie said. I mean, they know. So if you post your labs, or if you haven't yet, definitely do that. And you've got an insight of like, oh, this is a mess. This is too high, reverse is too high, free T3 is too low. You have no hormones, and tying back to your symptoms that you put in the post, then that way, And here's the other thing. If you have symptoms, and this really is for anybody on the call, when you have symptoms, those symptoms are gifts given to you by your body to say, hey, something's not right. So when you have symptoms, you have a problem, period. End of story. Like gaining weight randomly is not how our bodies were actually made. Losing the hair out of our head, not how our bodies were made. Dragging ourselves through the day. Nope. Bodies weren't made that way. Our bodies were actually made to function at an optimal level. Did you know that? Did you know that? Our bodies were made to function at an optimal level until the day we die. The reason why our bodies don't is for a variety of different reasons. Obviously, toxin exposure. But what does toxin exposure do? It harms our liver, and it basically messes up our endocrine system. It's a huge endocrine disruptor. It causes cells to morph and possibly become cancerous. But that's an exogenous source coming in. That's not how our bodies were made. Our bodies were originally made to process a certain amount of toxins, never thinking that we would have to withstand the toxic burden that we have today. Then, in addition, the reason why our bodies break down is lack of hormones. So over time, we start to lose ovarian function, reproductive function. All of our hormones start to drop. This is when thyropause occurs after the age of 40. Due to those fluctuating hormones, our thyroid gland takes a hit, and now we are experiencing symptoms. Those symptoms can be reversed with proper hormone supplementation. When we add back in the hormones, whether it's thyroid hormone or sex hormones, then we can have an optimal body. But when you have symptoms, that is a red flag that something's going on. Something's not right. Something needs to be addressed. So, Tracy, book a call with us. We can go over the programs, your options, all of that. We just do not read your labs on that call. Okay. Diva, you're going back with Melissa. Okay, you guys got that down pat. Miss Laura says, thank you. She did lower the T4. We discussed increasing the T3. Good job. You're on the right track. On the right track. Rebecca, you're answering somebody. We're good to go there. Thank you for doing that. Olivia, my doc started me on Pregnenolone and DHEA before jumping into bioidentical hormones. Do you ever treat like that too? And best to start on hormones or thyroid first? Thanks, Amie. Okay, Miss Olivia, let's break this down. This is a great question. Very commonly asked question. So that's why it's so great, because when you guys ask your questions, I can't tell you the amount of people that have the same thing going through their head. So don't be scared to post it, because you are actually most likely asking the question of somebody else anyways. All right, Olivia. So Pregnenolone stands on its own. Pregnenolone is a precursor hormone. It's kind of like the foundation of hormone building. So the foundation of all of our sex hormones, we can build them off of Pregnenolone. Also, Pregnenolone is connected over here to the adrenal glands, like we talked about earlier, how the adrenals will steal Pregnenolone as a building block in order to make cortisol. If the adrenals are stressed, if the person is stressed and they're starting to wear out, this is where we get adrenal burnout, adrenal fatigue, where it's not producing enough cortisol. It will steal Pregnenolone to make cortisol. But no, we do not give Pregnenolone in place of a hormone, estrogen, progesterone, testosterone. We do not give DHEA in place of estrogen or testosterone. Many doctors practitioners will say, here you go, Sally, all you need is DHEA. Well, what that tells me is they can't prescribe testosterone. They don't have a DEA license. So they need a workaround. And that workaround is telling you all you need is DHEA. That's all you need. No, we give DHEA to treat low DHEA. We give Pregnenolone to treat low Pregnenolone. We give estradiol to treat low estradiol, progesterone to treat low progesterone, testosterone to treat low testosterone, and thyroid hormone to treat low thyroid hormone. We don't give DHEA to treat testosterone. And the reality is it doesn't really help. It doesn't. I mean, there are way too many practitioners that will rely on it because they have to, because they have no other means to tell you they can help you. But the reality is it does not increase testosterone that much. I mean, you might get a small bump from it. You know, there might be the random person in the audience that goes, I took DHEA and my testosterone rose by 10 points. Okay, good. Golf clap. Good job. I'm glad it worked for you. 99% of us, it doesn't work for. DHEA treats low DHEA. You always want to do thyroid and hormone treatment together. You don't do one without the other. So why? Because testosterone, very protective against the thyroid, actually helps reduce inflammation and helps reduce antibodies. This is why men get hit so much less with thyroid than we do, because they have more testosterone. It's like an armor. It's like a shield of armor against autoimmunity. Of course, we want to do both at the same time. When we're treating thyroid levels, hormone levels can somewhat improve, but you're not going to treat someone who is 50 years old with low thyroid function and think that you're going to bring her hormones back to that of a 30-year-old. That's not going to happen. We can bring your hormones back to a 30-year-old by treating hormones, but not by treating the thyroid first. And that's another, this is another public service announcement. I like giving you all things to look out for. And again, in the book is a laundry list of exactly what you need to look for in a doctor or practitioner, what you need to ask them or their staff when you call before you pay, write a check, give a credit card. There is a laundry list of things that you need to know before you sign on with that person. So I tell you how to look for a doctor, and then I tell you how to talk to your doctor. And one of those signs is, well, Olivia, we're just going to treat your hormones over here first. And then we'll check your thyroid later. Cause I I've heard this before. By giving you testosterone, your thyroid will come back online. What? What? What medical school did you go to? Were you last in your class? Like what do you do? What? No. Testosterone, I mean, it'll lower inflammation, but nobody has raised their free T3 level by taking testosterone. Those are two separate hormones. Have to do them both at the same time. Both at the same time. Lisa's jumping in. Yeah, real people. I'm a real people. I know, right? I'm a real people too. No AI here. Real. Let's see. Does the book cover hormones? No, Betty. I have a chapter in there on perimenopause and menopause and thyropause, but a hormone book will be a separate book. Probably the second one after this one. Yeah. I covered the importance of it in my soapbox that I just stepped down from where I said you need to do them both at the same time. Yeah, that's in there. But there's no way. I mean, we have sections of the hormones and why they're important, but hormone replacement and teaching that is a totally separate book. I didn't want this to become like a medical textbook. Jennifer, Dr. Amy's team works on everything at the same time. Yep, you know it, girl. You'll hear her say from head to toe, the thyroid runs the show. So it's very important to work on thyroid from the start. Gosh, I love it when I see things that people actually remember. Thank you. I love you for that. Thank you. Tracy, looking forward to see what is next to get healthy. You know it. You're on the right track. You're here. You're learning. I love you for it. You're learning. That's fantastic. Joanna, Dr. Eric Balaklavich. I always call him Baklava. Dr. Eric Baklava keeps saying on his podcast that we should also run total T4, total T3, T3 uptake along with TSH, free T3, free T4, and antibodies. What are your thoughts? Pointless. I mean, if you throw them in, we're not gonna, we'll look at them. I mean, I'll look at the total T3, but I usually go, oh yeah, see, your total over here is low. That pairs up with your free. I mean, it's just, if you want to throw it in, throw it in. But we don't need it, if that makes sense. If it's written for and your insurance covers it, toss it on in, but it's not needed. It's not needed. Kelly, hello. Hi, Dr. Amie. I'm curious about what causes a young lady in early 20s to show optimal thyroid markers and then 2 years later go into being diagnosed hyperthyroidism and developed PCOS. Is this liver clearance and hormone clearance issue in the liver? So let's break this down, Kel. So early 20s, we have to think what's happening in a woman's early 20s. And did the PCOS come first? So PCOS, polycystic ovarian syndrome. Diagnostic criteria is all over the place for PCOS. We see sometimes elevated aldosterone, elevated testosterone, elevated DHT levels. That's why young girls will develop excessive facial hair or acne with PCOS. Those androgens being elevated affect insulin levels. So insulin resistance is huge with PCOS. Now, think about what that actually, and then stopping of cycles, amenorrhea, low progesterone, and sometimes estrogen dominance will also accompany PCOS as well as infertility. So it's this mixed bag. And not all that. The crazy thing with PCOS and diagnosing PCOS is not all boxes have to be checked. You could have 2 out of the 10 boxes checked. It's like, it's PCOS. Now, then we can also, here's where it gets even trickier. We can do a vaginal ultrasound to check for little cysts on the ovaries, but they're actually thinking of changing the name of PCOS because you don't have to have the polycysts, the multiple cysts on your ovaries to actually have PCOS. So they need to think of another name because sometimes we'll have the amenorrhea, the infertility, the insulin resistance, and the androgen dominance, the low progesterone, and the estrogen dominance without cysts on the ovaries. But we have the mixed bag of other metabolic issues going on over here that we have to address. So that hormonal shift, and to this day, I couldn't tell you what causes PCOS. Don't know if anyone knows, honestly. So we have the hormonal shifts in a young body, these elevated androgens, low progesterone, not cycling, not detoxing because she's not bleeding. She's going into estrogen dominant. I mean, that is enough to turn on Hashimoto. So think about what flips that switch of Hashimoto's: puberty, pregnancy, perimenopause, menopause. Those are the 4 big times in a woman's life where Hashimoto's will turn on and present itself. PCOS is no different. So when a woman goes through polycystic ovarian syndrome, hormonal cascade, hormonal roller coaster, that is enough that it can turn on the Hashimoto switch. It can turn it on. Now, does the liver play a role? Yeah, I mean, the liver can absolutely play a role, Kel, but addressing the liver is just one little key component. We can't say, oh, well, it's because of her liver that this whole shit show happened. Like, no, the liver plays a role and we should address it and love on it and make sure it's working properly, especially if this poor woman is in an estrogen dominant state. But why don't we give her some progesterone? Because that's beautiful for PCOS. Give her some progesterone, give her some berberine to help with the insulin resistance. So both of those things are going to help with the acne and the estrogen dominance and the water retention and the cycles. So we can bring back her cycles with progesterone. We can reduce estrogen dominance with progesterone. We can treat the insulin resistance, which then it inadvertently helps with the androgen dominance. And then let's treat her thyroid. So that's what I would do. All right, peeps. Last question. Okay, wait. Lisa is saying, when I started with Dr. Amie, we had to lower my dose by more than half to get my body out of survival mode and to lower my reverse T3. So you were talking about your T4, Lise, which had been blocking all of my T3 like you. So you were talking to Laura. Oh my goodness. We have reached the top of the hour. I need to say goodbye to you, but we got through all the questions, I think. I love being here with you. Please spread the word about the book too, because again, going back to what I said in the beginning, it's the algorithm. It's spreading the word. It's telling the algorithm that this book needs to be in the hands of every single person over the age of 40, male or female, every single person over the age of 40. This is your thyroid Bible. It will knock your socks off. It's going to piss a lot of doctors off. And that's what I'm here for, to disrupt this entire health space, because we need a little bit of a shakeup. Don't you think? Don't you think? So be part of that shakeup. Be part of that disruption with me. Yes, pre-order the book, share it, buy a couple of them, get in on the badass bonuses, get some free stuff. Go to thyroidfixbook.com. If you're interested in the bulk buy, just do /bulk buy, BULKBUI, and jump in on the bonuses. I thank you all. I love you all. I love being here with you. If you're on Instagram, bounce over because you're missing out. You should absolutely have FOMO right now, like hard FOMO, because you are not in the Just Fix Your Thyroid Facebook group, and you should be. That's how you get your questions answered. So we will see you over there in the group, and I will see all of you guys in the group next week. Keep your questions coming though, because I'm in there. I'm in there answering them every single day. All right, peeps. I love you all. We'll see you next week.